I think that CBT is kind of bullshit. The reason I say that is because I believe that most people that engage in CBT get a superficial sort of help. Whereas in psychodynamic therapy, if you get the right therapist, which I also think is difficult, you have an opportunity to truly change your life. And I've seen that firsthand.
There's a lot of people for whom the ability to survive, quite literally to not kill themselves. I don't think it's true that psychodynamic therapy can't help these people. But I think there is strong reason to think that CBT is much more reliable as a go-to treatment for people with really serious, pressing issues.
Welcome to another Thoughts and Feelings dialogue. As a reminder, a dialogue is where you listen carefully to the other person, stop and think about what they said, and generally try to take on their perspective. I'm here with Nick today, and we're going to talk about cognitive behavioral therapy versus psychodynamic therapy and see what we can learn about both. So welcome, Nick.
Thanks. Good to be here.
So in a moment, I'm going to ask you to give me a little bit of your background, why this is an interesting topic to you, why you're suited to talk about it. But where this starts for me is that I have a belief that I would say most people disagree with, and I'll put it bluntly. I think that CBT is kind of bullshit. And the reason that I say that, and I don't mean all the time, for certain use cases like, trying to quit smoking or something, I'm sure it's great. The reason I say that is because I believe that most people that engage in CBT get a superficial sort of help. Whereas in psychodynamic therapy, if you get the right therapist, which I also think is difficult, you have an opportunity to truly change your life. And I've seen that firsthand. So anyway, that's my belief. Again, why don't we start with a little bit of background on who you are and, whether you've been in therapy in your life, that sort of thing. And then we can get into your opinion on the topic.
Sure. So, I've definitely been in therapy since college. I was in therapy briefly when I was younger, but basically for the past 6 years now, I've certainly been in therapy. And I've done both CBT and psychodynamic therapy. The large majority of that time is psychodynamic therapy, in part because CBT tends to be shorter. But I'm quite fond of both, actually. And I had this sort of unique luck. I actually work in mental health, and I got into that by volunteering at a crisis and suicide hotline.
Wow.
And then I sort of took the leap, and I worked at a psychiatric hospital for 2.5 years. And what I had the unique luck to experience was that I was in a program where our treatment model was what's called DBT, Dialectical Behavior Therapy, which is part of what's known as the third wave of cognitive behavioral therapies. I can say more about that, but my job was to sort of help highly suicidal patients get through difficult moments. And the general goal of DBT is to build a life worth living, much like any psychodynamic therapy, rather than symptom alleviation, which is what CBT is often criticized for, focusing on. But the short of it is I spent 2.5 years doing that, learning about therapy, working with patients directly, and now I'm in school training as a therapist. And this year I'm at the CBT clinic. But what I forgot to mention is that while we were doing DBT, I had bosses who, the way they'd been trained and educated was very much to understand what was going on interpersonally from a psychoanalytic point of view. And for me, that's a very powerful combination, to be able to do CBT while in your mind understanding what's happening in the room from a dynamic perspective. So anyway, now I'm a therapist in training and interested in both.
I think I want to back up because I'm interested in the fact that you've done all of your kind of all the professional experience you mentioned, which must be most of your professional experience, has been in mental health in crisis related situations, suicide. I mean, that's a very striking thing to want to go into. What makes you want to be around people that are at the moment of wanting to end their life?
It's a good question that I've certainly spent a fair amount of time talking about in therapy. I think, I have my own personal experiences of being close to people who've been suicidal, but it's less a specific attraction to that than it really came from, for me. My interest in psychology didn't come from interest in a medically or biologically based model of mental illness, but an interest in suffering. And if you're interested in helping people who are suffering and understanding suffering, then whereas I think maybe 100 years ago I would have gone down some other route, today the route that you end up going is entering the quote mental health field. So it was less an interest in suicide as like a psychological thing or per se, than if you want to help people who are really suffering and you're game to do that. One of the people who suffer most tend to be suicidal. And so that's how I got there. Yeah.
That's very interesting. I don't know if I agree that the people who suffer the most tend to be suicidal, but I know what you mean. I feel like they either tend to be suicidal, homicidal, or psychopathic, like something really extreme. Because if you don't go down the route of wanting to kill yourself, maybe that's just not the channel that your defense mechanisms go down. It's hurting others, or some sort of grandiosity to the extreme or something. But I know what you mean. I'm not trying to be nitpicky. And I hope you don't mind. I'm curious about a person that chooses to go into mental health. So I have another question. One thing that I notice about you in the first few minutes of meeting you is that you're very calm. I feel like it would be hard to kind of sway you or get you to depart from the calm track that you're on, and that's wonderful. But it's unusual because I'm used to talking to lots of people that they'll express something more towards the edge of emotions, and you're sitting right in the middle from what I can tell in a few minutes. Is that something you've always had, or is that training related?
Definitely not something I've always had, nor do I think it's really something I have now. I think that might be how I come across. And it's interesting because as I've grown older, people tell me that's how I come across, but it's certainly not how I feel internally. I think I'm very susceptible to strong emotions and shifts in how I feel or think about things. I do think part of it is, spending, and I was a very delicate child. I mean, I cried a lot and shouted a lot. And that's certainly not how I've been constitutionally. But I do think that, spending 2.5 years working up to 40 or at brief periods, 60 hours a week in a setting with people who I was working with people with borderline personality disorder, so people who experience very, very intense shifts in mood all the time. It does give you a sort of, I can actually share. I remember volunteering in college very briefly at this halfway house for these guys with developmental difficulties who were in the correctional system. And there was this counselor who worked there, staff. He was this big buff guy, and he was so zen. Anything could happen, and he would just be utterly calm. And I thought, how cool it would be to be someone like that. But that's never going to happen for me. And the thing is, if you spend 2.5 years in a setting where really, I mean, a lot of the time it's calm, but there are also periods where there's a lot of yelling, there's a lot of anger, there's a lot of suicidality. I mean, it changes you, and it gives you an ability to have, I've always thought that if you want to get less sensitive to your small problems, not prescribing this, but one way to do that is to have bigger problems. And when you face these really intense situations, I do think that less intense situations shake you less. I mean, you develop this sort of zen that I actually think has some trade-offs. I don't think it's totally a good thing all the time. But I do think your ability to deal with I do think you cultivate a certain ability to be steady.
Makes sense. It made me think of a few things, but maybe I'll come back to them in a bit and we can get into my criticism of cognitive behavioral therapy, which you summarized in a wonderfully pithy way, that it treats the symptoms. So perhaps it's not so original for me to feel that way. It sounds like you encapsulated it pretty quickly. So tell me where I'm not understanding correctly or partially understanding.
Will you tell me a bit more about your understanding?
Sure.
Yeah.
So my experience doesn't come from personally, having a cognitive behavioral therapist. I have only had psychodynamic therapists. I think I've had about 10 therapists since I was in the single digits. Ever since I was young, there was a lot of court battles and family court battles, and there was a lot of prescribing of therapists. It's possible some of them were trained in CBT, but it seems like I was always talking about my childhood, my feelings, that sort of thing, and there was never a solutions-oriented therapy. However, I talk about therapy very openly, and I'm around a lot of people that start therapy, maybe in part because they hear me talk about it and what a positive difference it's made. And I think a lot of people think they're attracted to the idea of therapy, but they don't want the level of difficulty that psychodynamic would present them with. So they either go to a religious figure or something like that, who is not at all doing something in the realm of therapy, or they go to somebody who specializes in a particular type of issue, like a money therapist or something like that. And I start to feel like it's a blend between like a life coach and a therapist when someone specializes like that. If I see the therapist advertising themselves too heavily, I think I'm seeing the therapist's problems, or it's too personal. But I'm certainly not saying that all cognitive behavioral therapists do something like that. But it begins to touch upon my impression. When I've known many people that have been through several years of CBT, and I don't see much change. I rarely see people change from therapy because, well, they change a little bit, certainly, but I rarely see major changes from therapy because most people, A, can't afford it. It's too expensive to work with a good therapist out of insurance network. And B, they don't go for long enough. And I guess C, they don't go to the right therapist. And I think it's hard. How would you know who the right therapist is? How would you know if the therapist isn't putting their issues onto you? If I had to guess, I would say the majority, more than 50%, are doing a good amount of this unconsciously.
Is that an experience you've had?
Yes, I would say I remember 3 of my therapists before my current analyst that I'm with right now. And all of them in some way have done that. And they've been helpful for a stage of my life, but it's difficult to see the difference between someone that acts as a parental figure, which I think a therapist very easily becomes, and somebody that changes the way you think about yourself and gives you tools that get embedded in your psyche that automatically start to take care of really extreme situations and allow you to have more freedom, which is what I've experienced with my current therapist. But I think it's because I've gone and really, really dedicated myself to it and been very, very open to doing things I didn't want to do in terms of the emotional and mental work. But yeah, I've just noticed a lot of people that just go to therapy for years and years, and it feels like babysitting. And it's usually a CBT therapist, because I think it's a bit of a cop out to say, oh, great, they're going to like deal with this ADD I have or this anxiety I have. And I always think to myself, oh my God, you don't realize that that's just the symptom of trauma that you have. And I hope for everybody that I see in that situation that they will eventually see a psychodynamic therapist. And perhaps you'll enlighten me that the other type of therapy I've never heard of that you study is a nice combination of those, because there is a need, of course, for practical day-to-day stuff. A parent dies, you get fired from work, of course. But, I deal with that in my therapy as well. We don't only dwell on my childhood. But yeah, I've just seen a lot of people not make much of a difference. And I think that they don't really want to make much of a difference.
Well, I certainly do agree with one thing that you sort of said. I mean, I agree with a lot of what you said, but, when you said, oh, I wish that they would go see a psychodynamic therapist. And I certainly share that sentiment in the sense that I think, generally speaking, a very sound thing to do after a CBT treatment is to go see a psychodynamic therapist. CBT can be a long-term treatment, but it doesn't, the understanding of therapy is not centrally defined by it being a long-term therapy, whereas with psychodynamic therapy it is. So I mean, I consider myself fortunate that I did what I did, which I had a great experience with CBT, and then later I had really good experiences of psychodynamic therapy. And I think for people who are, relatively high functioning, as I think it's safe to assume that you are by all appearances, and that I'm guessing most of the people that you and I both know are, I think that's a pretty solid recommendation to see a CBT therapist for a while and see if there's one aspect of what you need to work on that's actually really achievable in a shorter time there. And then there's also the work with the psychodynamic therapist. I think the question is, there's a few different ways to tackle it, but I think the most salient one is that a lot of people don't live really relatively high functioning lives. And, those of us who see therapy as a sort of enhancement for our lives, that's not everyone's experience. And there's a lot of people for whom the ability to survive, quite literally to not kill themselves for another year, or to have the ability to get out of bed, go to work, get enough money to not depend on others or to not live on the street, to abandon substance use that is killing them. There's really a lot of people who have these problems, and while I don't think it's a black and white thing to say, I don't think it's true that psychodynamic therapy can't help these people. But I think there is strong reason to think that, at least from a certainly from like a public health point of view, but even for the most part on an individual level, CBT is much more reliable as a go-to treatment for people with really serious pressing issues.
I understand.
And I think, so it helps to go, and also it helps to divide. Sorry, I think you were going to say something and I cut you off.
Well, I think I interrupted you. I just wanted to say that does make sense. I don't usually think from the point of view of the many people that are in really desperate situations and not enhancing their lives. And I think your point is a good one, that sometimes people need a step up, which it almost sounds like it's playing a role similar to what medication does. And I guess they probably work in tandem sometimes, where it's just a rung of a ladder out of the hole, before you fall down. Or maybe it's a few rungs. But something practical needs to happen, and almost the luxury of a long-term exploration of your psyche, your childhood dynamics, your the hidden trauma of your life. You don't have the time.
Yeah. And that's true for really a lot of people. You can take like a few different examples of where CBT excels, right? So one example is OCD. My understanding, without having a detailed knowledge of the data, is that OCD is the clearest cut sort of case study of where CBT is very effective through exposure therapy. You can have somebody who has OCD and they can, to have OCD, you have to be spending an hour a day in compulsive behaviors.
Mm-hmm.
That's really a huge chunk of your life. And for a lot of people, it's a lot more than that. You just got to think, what if my life involved 3 or 4 hours a day plus of washing my hands?
That's sad.
It is. And we have good reason to think that, yes, what we can call talk therapy might be helpful, but what's really helpful in 8 weeks is exposure therapy. And the idea is that exposure therapy isn't going to make this person's life excellent. In fact, the most likely outcome of most CBT treatments is that once the concrete immediate problem goes away, the person sort of realizes that they really have so much bigger problems to work on.
Mm-hmm.
But you can't really improve your life in any meaningful way if you're spending 3 or 4 hours out of your day hand washing, or at least your ability to do so is extremely limited. So if you can spend 8 weeks doing exposure therapy, which if you don't know, involves a sort of structured ladder of doing things that create incredible anxiety, with the goal of that anxiety attenuating as you habituate to the anxiety and it goes down. And suddenly, after not that long period of time, most people with OCD will have cleared up a chunk of their time and mental energy to be able to live a fuller life, where 3 or 4 hours a day are not spent hand washing. And I think that's a pretty good model of what CBT is about, because you actually said something earlier where you're talking about how psychodynamic therapy has left you with these like internal resources that can get you through difficult moments to create a fuller life. I mean, I couldn't come up with a better motto for CBT either. And, you know, for a lot of people, a lot of their life, you know, it's easy to say, oh, it just targets symptoms. But for a lot of people, symptoms are a huge part of their life that are really blocking them from doing the things that are important to them, you know, doing things they enjoy, working effectively, having meaningful relationships. And where the third wave of CBT treatments, which are so, I do think it helps to give like a bit of a, you know, there's a sort of historical slant to all of this, you know, the conflict between psychodynamic and CBT therapy. It's there's like a lot of, there's the shift to managed care and insurance that made a big difference. There's the arrival of antipsychotic and antidepressant medications. There's brain-based neuroscience. There's all these different sort of historical developments that have shaped the field. But I think what's important to note is that like the modern history of CBT, which consists of treatments like dialectical behavior therapy and acceptance and commitment therapy, is all about how to build a life worth living. I mean, acceptance commitment therapy is a branch of CBT. And to your point about symptoms, I mean, the entire ethos of it is to, and it was developed for people originally who struggle with chronic pain. It was helping clients shift away from making their life about managing symptoms and moving towards living out their values. You know, the guy who created, he's always saying, you know, what would you do if you weren't depressed? Do that. Mm-hmm. That's kind of the motto. So, yeah.
Maybe you just want to tell me briefly what DBT and ACT are?
Yeah, so DBT was created by Marshall Linehan in the late 80s to help highly suicidal patients. It's a sort of big, like there's a lot of different parts to it, and it's a manualized treatment, meaning there's a specific way you're supposed to do it. And it was Marshall Linehan, I mean, it's a pretty, you know, you have to remember, I mean, or know that 40 years ago, if somebody was, well, you know, how diagnosed with borderline personality disorder, they were viewed as untreatable. Mm-hmm. There was nothing anybody knew how to do that could reliably help them. That's not true today. And Marshall Linehan asked all of her colleagues, she said, send me your most difficult, hard to treat clients. And she was what's known as like a radical behaviorist, someone who's not interested in the contents of your mind, but in what you do. And she tried to work with these suicidal clients and basically send this message of, your life's not going to get better until you change it. And the thing about working with people with personality disorders is they're not going to want to work with you if you tell them that. That's a very hard message to hear. So basically what happened over time was she integrated this behaviorist way of approaching things with actually her own interest in Buddhism and with self-compassion, mindfulness, validation of experience. And by sort of merging these two ways of thinking, she developed this really complex treatment, or complex is not the right word, like it's a sophisticated treatment that now is the sort of universal world standard for treating borderline personality disorder and other problems, where the goal is in the short term to build skills, practical things a patient can do to get through difficult moments. And one of the famous ones is like holding ice or doing what's called an ice dive. And I recommend trying this at home. I mean, if you're ever about to lose it, the thing is, if you fill a pot full of ice water, dunk your head in it for 30 seconds at a time, 3 times in a row, you're going to feel different. Yeah, and people think that's crazy. Mm-hmm. My parents think that's crazy. A lot of people think that's a cruel, or that's so extreme. But the thing is, if you deal with anger that's so overwhelming that it gets into situations that really mess up your life, what's better, that or dunking your head in ice water? Obviously, it doesn't fix all your problems, but it helps. But that's the short-term goal.
Mhm.
The long-term goal is, once you've built up these skills, to try to let go of them a bit, to rely less on concrete things to deal with your emotions, and instead to be able to ride the wave of emotions, accept that a life well lived involves a lot of pain, a lot of discomfort, a lot of unpleasant emotions, and that really the most you can do with them is nothing. And instead start doing things you enjoy, start doing things you are meaningful to you, and have better relationships. Yeah, which, sort of converges, I think, with the psychodynamic view of, and other points of view. Yeah.
Very interesting. It almost sounds like you're just broadening my understanding. It's like when I hear people talk about therapy, I'm usually just thinking, well, psychodynamic is therapy, like where you start to change the borders within which you live. No longer do you live in such a narrow space where you're bumping against your defense mechanisms from your childhood and things that you're afraid of, but you can broaden it out and you have more freedom. And actually, there's a lot of other situations for a lot of people that I guess I just don't spend time with, and so I'm not thinking about them as much, who just need immediate help for symptoms. So it's interesting that you basically just sort of embraced the criticism and said, well, actually, that shortcoming that you're bringing up, that the idea of treating symptoms is more important than you realize. And I completely bought into that now that you explained it to me. That makes a lot of sense.